Well, hello, everyone. Welcome to this episode of our Family Matters series. As always, we're so happy to have you all join us. Our topic today is a great one because it really is relevant for all older adults and their families and caregivers. Today, we're going to discuss strategies to plan for a primary care physician visit with your loved one or for yourself. So, for this episode, we are joined by our expert, Lynn Young. Lynn is a speech language pathologist with many years of experience working with older adults. Welcome, Lynn. Thank you
Thank
for being
you.
here.
Of course, I'm glad to be here.
Great. So, okay, before we jump in and start discussing preparing for a physician visit, Lynn, would you mind taking just a minute to introduce yourself and maybe tell our listeners a little bit about your background?
Sure. My name is Lynn Young, and I've been a speech pathologist for over 30 years. I've worked with a lot of adults and older adults across the continuum of care, from hospitals to inpatient settings like inpatient rehab, folks living in assisted living or skilled nursing settings, and then people living out in the community that are still obtaining services like outpatient or home health. I've worked with persons with cognitive impairment for multiple decades, particularly people who've had either an acute event like a car accident or a traumatic brain injury, as well as persons that are living with dementia. So I know the unique needs of this population and how this topic can really impact their success or failure when accessing the healthcare system.
Wonderful. Well, you are certainly a subject matter expert here, and we
I hope so.
appreciate you being here to share your expertise with us.
Sure.
Okay, so let's just dive right in to the topic. So, first of all, managing one's health can be challenging, I would say, under the best of circumstances. Navigating the healthcare system, making appointments, interpreting results in your online chart, then following up with referrals, it can all be pretty overwhelming. But for a person who has memory or other cognitive impairments, and even if those impairments are mild, it can be more difficult. So, if you have a loved one who is struggling to manage a healthcare visit, what could some of the reasons for that be? So, in other words, what underlying thinking skills are necessary to manage a visit with a healthcare provider?
Yeah, great question. With persons who have even subtle changes in their cognition, they may experience challenges or difficulties with the healthcare system. And I'll go through a couple of what I would think of as the underlying skills needed to successfully navigate our very complicated healthcare system here in the US. First one is memory. Right? From having a login and password to your My Chart and remembering that, we often get asked, what are your medications? What are you taking? How often do you take those? Have you been to other appointments? Have you followed up on your annual screenings? Memory is such a key ingredient to self-reporting to your primary care physician in an accurate way. So if we have a memory impairment, that could really impact the information we're able to convey. Attention to detail is another one. Things are very precise in the healthcare system. So if you're supposed to take a certain medication, the dosage might be in question. You have to really be able to adhere to that in a way that's 100% correct. You could actually have side effects or health issues if you can't. Executive function is another one that I think of. That's an umbrella term that really covers a multitude of tasks from sequencing, planning, organization, being able to record an appointment on your calendar and access that appointment correctly, plan for your transportation to that appointment. Maybe you're supposed to do blood work or something before the appointment. So, sort of keeping track of all of those steps can be really challenging. Even simple things like reading, being able to read complex information. We get a lot of information from the internet where we're all sort of looking up things before we go to an appointment sometimes to understand more about our condition or the symptoms we're experiencing. That information is often very complex. And sometimes when we receive information from healthcare providers, whether it's, mailed to us as a follow-up to an appointment that we had, or if we're getting written instructions after a procedure, there can be a lot of steps and a lot of content there that we really have to be able to decode and read for specific detail. I often think about in my work as a speech pathologist, listening and speaking skills, just basic comprehension and expression. Can you take in the questions that you're hearing, understand what they're asking, and provide enough detail to your healthcare practitioner so that you can report symptoms or side effects or pain or anything that's going on. So having those just communication skills is important. And then lastly, but not least, really technology skills, right? We have to be able to navigate some form of technology, whether it's your practitioner's online portal or your sort of My Chart or other access point to see your test results. A lot of times we're getting reminders on our phones that we have an appointment, type yes to confirm, right? Or we're getting emails that have, packets, please fill this out before you come. So we have to be able to manage some form of technology and even sometimes do mathematical equations, right? If you get your lab values, you have to understand and compare them to other normalized ranges to see if you're above or below the norms for, let's say, your cholesterol or other things that your physician might be tracking. So it's a lot more complicated than just kind of showing up for your appointment and answering a couple questions. You really need some of these skills to go into that appointment to be successful.
Wow, I feel, and when you break it down that way, it's no wonder that it can be that like healthcare visits can be overwhelming for
For sure.
people. And then when you add on top of that, people with cognitive impairment might have deficits in some or even all of those areas that you just listed. So, Lynn, how could a person with cognitive impairment and their family member or caregiver prepare for an appointment ahead of time to ensure that the visit is a success?
That's a good question. Caregivers are critical, right, to preparation. And even if they can attend the appointment, they really can make a huge difference. Preparing ahead of time with your loved one will make that doctor's appointment go a lot more smoothly. I think sometimes just knowing what questions they might ask, understanding what your responses should or could be, making sure they're accurate, and allowing that person to answer for themselves. I think sometimes caregivers want to jump in and help, but when they're posing a question to your loved one and they're saying, how's your pain been? And the caregiver's jumping in with, oh, he hasn't said anything about it. And the person's saying, oh, it's a 5 out of 10. We want that patient to feel independent and be able to, have the conversation, the autonomy to have the relationship with their provider. But sometimes practicing posing some of those questions up front could be really helpful.
Okay. Um, I really like that idea of preparing ahead of time, especially because healthcare provider visits can feel so rushed. And it sounds like, just based on what you said, that the more organized you can be ahead of time, the better. Would you mind giving some specific suggestions to our listeners on how to best prepare for an appointment?
Sure. Yeah, absolutely. So I talked about having a support person or a caregiver available to either help you prepare or to even attend the appointment with you. It can be nice to have a second set of ears, right? Another person who hears the information, who maybe could take some notes, who can help, support and help you remember after the fact. Now, what did he say about this? Am I supposed to call my doctor? Are they calling me? Right? Just having that other person there can be somewhat helpful. We get hit with a lot of complex information at a doctor's appointment, and it can be, to your point, pretty quick. It's coming at you fast. You may not be able, as the person with cognitive impairment, to navigate all that content and be able to take notes in the moment, right? To be able to like jot things down as you're listening. That requires, again, a lot of attention skills to listen, but also be writing something down at the exact same time. So sometimes they can be your note taker if you can bring somebody with you. You can also bring notes ahead with you that you wrote at home. Maybe you know what questions they might pose. Every time you go, you talk about, your weight loss plan or your medications, or you're talking about sleep or other things that have been problematic for you. Maybe you can jot down some things ahead of time so that you can bring that to the appointment, symptoms that you've had, changes that you've noticed, when they started, how often they're happening, or even maybe some of the questions that you want to make sure you get answered at this appointment. So having notes of your own can also be helpful, as well as maybe taking notes during the appointment. We know most physicians are going to ask sort of a set of questions, right? We all get asked, what medications are you taking? Are you still taking X? Are you still taking Y? So knowing your medication list, even just having it on a piece of paper and bringing it with you so you don't have to sort of remember all the fancy names for all your meds and the dosages and the milligrams and all those things, as well as over the counter. A lot of people take vitamins and supplements and things of that nature. Your doctor might want to know if you're buying those regularly and taking those every single day. And gather your information ahead of time. Don't be scrambling the morning of your appointment to find your health card, your healthcare information. Or if you were supposed to bring, the disc from your ortho appointment of your, x-rays, try to plan ahead, try to get everything together and as far in advance as you can. And then if you know that you've seen a specialist or another physician and they're part of your care team and you have results, you might want to read through them just because your doctor may bring that up and want to discuss next steps or a plan. Refresh your memory, go back over some of that information. So I do think having a little bit of planning time up front can really make or break the appointment. And as a caregiver, you could even role play this. You could even pose some of the questions and have your loved one give the answers. And when there's gaps in knowledge or places where they're like, oh, I don't know my meds, you could create that list to bring. It'll help you figure out what parts they're going to be able to navigate pretty independently and what part of the appointment you might need to have some supplemental resources ready.
That's great. That makes sense. I can see that rehearsing ahead of time would help to make sure that the person is fully able to answer questions on the day of. And I could also see where that could help a caregiver to realize where they may have to fill in some gaps when questions are asked. Um, okay, so on the day of the appointment, as we mentioned, time with the practitioner may be limited and things may be hectic or rushed. I mean, again, even for people without cognitive impairment, healthcare provider visits can feel rushed. Your name is called, you are trying to gather your things to get out of the waiting area, put down your things to step on the scale, get ushered into the exam room, get your blood pressure taken, answer some questions. So even before you see the provider, you might just feel a little jostled around. So thinking,
100%.
yeah, so thinking of someone that does, again, have an impairment in their cognition, what could be some strategies to make the visit feel more successful despite the kind of, I guess, hectic, rushy environment?
Mm-hmm. Yeah, I think that role playing and that anticipation, sort of planning ahead, imagine what they're going to ask you. If you've been working on a certain healthcare practice, maybe you've been trying to walk more, or you've had chronic pain or a chronic condition that you've been back and forth several times to the emergency room or to a Med Express type environment, or you have new specialists on your team, those are probably going to come up. So think about the questions your doctor might pose during the appointment, both general health questions as well as any specific questions around existing chronic conditions you might have, and anticipate what your questions and answers might be. I think one thing that can hang people up a lot is like a pain. Are you having pain? If so, where? How often? What's triggering it? What environments? What are you doing about it? What are you taking? Does that work? Right? There's a lot of Q&A around something like pain. So knowing those answers ahead of time, if you're taking ibuprofen or acetaminophen, how much? When? Is it working? If it's not working, why isn't it working? Are you doing the exercises you were assigned? Things like that will probably come up. So you should have your answers at the ready. I think sometimes understanding as well that they're going to check on sort of general things, like they're going to ask you if you're an older adult, if you've had any falls. Are you managing on your own to do your dressing, your bathing? Are you cooking for yourself? Are you feeling depressed or down or sad? They often ask those questions to get a sense of your overall general health and also to connect you to resources. If you need physical assistance at home to prepare meals, they may suggest, Meals on Wheels or other community-based resources. So if you're struggling, this is the time to tell them that you need access to other resources and assistance. They may also ask you if you've participated in your annual screenings. Have you had a mammogram? Have you had a flu shot? All those things that help us stay healthy that are proactive versus sort of reactive. Be prepared with dates and times and places if you went and had those done, if you haven't had them done in the office. So you're not duplicating and you're not spending the time that you could spend on other topics going over why this is important and how it's valuable.
Mhm.
You can move right on to things that are just as important to discuss.
Okay, that's great. That's really helpful information. Um, so I think sometimes people don't want to admit, thinking of a doctor's visit, sometimes people don't want to admit that they didn't understand the information that the doctor shared with them. And not grasping the information, might be due to complex or unfamiliar medical terminology being used, or because an older adult has a hearing impairment, or maybe difficulty processing information quickly, or a combination of all of those things.
Right.
Um, how could a patient maybe slow down the interaction and make sure that they're understanding all of the important information that's being shared with them during the visit?
That's a great question. And I do think it's rarely just one thing. I think
Mhm.
I have a hearing impairment and a processing delay, and I'm anxious and upset because this is a scary environment, which is triggering, more distraction. And there's a lot of noise and people. So it all starts to compound on that person, and it makes that interaction even more challenging than it would be normally. But I think doing some things to reduce stress right out of the gate, like don't worry, you don't want to be searching for a parking spot 1 minute before your appointment time, right? So come early, have your paperwork filled out. Don't put yourself in that rushed mindset because the interaction may already be scary or frustrating or anxiety producing enough. Have your notes with you. That way you're not going to forget anything. You don't have to walk out and say, "Oh, I forgot to bring up X or Y." Have your notes. But also, I think it's important to set the stage for the interaction by telling people, hey, to your point, I have a hearing impairment. I don't can't really hear great out of this side. Can you sit on this side? Can we be looking at each other so that I can fully understand what you're asking? I might need you to repeat a couple things. I may not hear it or I may not really understand it. Is it okay if I stop you and slow down and ask, hey, could you go back over that again? I'm not sure I got that. A good way to do that is to repeat back what you think you heard. So what you're telling me is I'm stopping this medication and you're prescribing a different one. So I'm no longer taking that after this appointment. I'm done. Like just double check you heard what you thought you heard so that your healthcare practitioner knows what parts of the message you're receiving and what parts of the message may still not be clear and they may need to give that information again or give it in a way that's easier to understand or to digest. If you're able to take notes, that's great. Taking notes, writing things down, or even just staying in the appointment after the doctor has exited while it's fresh in your mind and just jotting things down, whether it's on a notepad or in your phone, in any way that helps make it easiest for you so that you can take that information back to other practitioners or your family members if you're flying solo at an appointment. But I think being empowered to kind of manage the interaction and not just let it run away with you, you set the tone of what you can and can't take in and how much you're getting, I think is really helpful.
It's great advice. I really love that strategy of taking a minute right after the visit to just write down, so maybe the things that transpire, the instructions from the visit before you get in the car and life just gets, chaotic and busy. Okay, so Lynn, another question that many of our listeners may be having is how to bring up a loved one's cognitive impairment at a visit. It's easy for me to say that this is no different than saying to a doctor, my mom has back pain or my dad isn't sleeping well. But I know that for many people, mentioning a loved one's cognitive impairment might feel a little uncomfortable.
For
So
sure.
if your loved one is experiencing symptoms like, let's say, memory impairment, confusion, or difficulty completing daily tasks, what would you say is the best way to open up a dialogue about this? Because I think it's really important to bring this up at a visit.
So the first thing I would say is I wouldn't bring this up at the doctor's appointment the first time that you two have discussed it. If a caregiver and a loved one are noticing changes, I would bring that up before the appointment and agree that we're going to discuss this with the physician while we're there. You don't want to blindside somebody. You want them to be part of the conversation. You want them to be able to have these, advocacy conversations with their own primary care physician. And if your primary care physician isn't taking it seriously or you don't feel you're getting the answers that you're seeking, ask follow-up questions. What can I do next? Should I have more formal assessment done? If you had a hearing impairment and you went to your doctor, they would probably recommend that you have your hearing tested. And if your hearing test shows you've had a change, you'd get a hearing aid. Memory and cognition are the same. You want to get a baseline. You want to know where your deficits might be so you can seek resources to start addressing these underlying issues. As a caregiver, you may need to bring up some of the safety issues. Your loved one may not have the insight to bring up issues like maybe I'm unsafe driving, or I almost got taken advantage of through a phone scam, or I almost gave out my checking account number. Managing finances might be a concern. Sometimes it's nice to have a third party person to just bounce these ideas off of so it doesn't sound like you're trying to wrestle things off of your loved one. You're taking the doctor's advice. So I think, asking for resources and secondary, connections to make sure you're getting these ideas and concerns addressed is really important. And then after the doctor's appointment is over, sort of put your heads together and come up with a plan. What is our action plan from here? I heard this. I did too. Okay, so we're going to follow up with a specialist. We're changing that medication. When we get home, we're going to take that out of your pill box. Okay. We need to update your emergency contacts. Whatever's going on at that appointment, you want to do the follow-up together to make sure it gets done, but also to make sure that you can help implement any safety recommendations or even lifestyle changes. Routines are really hard to change. So having a partner in exercise or having someone to prompt and remind you, hey, don't forget, you're supposed to, be cutting out sugar in your morning coffee or, all the things can really be helpful to have another person on board with your health plan if you are struggling with underlying cognitive impairment.
Those are excellent tips. Lynn, thank you so much for being here. Thank you for being here and sharing your knowledge. This was really, really, as I said, helpful information.
Sure.
And to our listeners, I hope you all feel a little less overwhelmed at the thought of helping a loved one manage a visit with a healthcare provider, whether that's a primary care provider or a specialist. And of course, thank you all for listening to this episode of Family Matters. We will see you next time.
Thank you. Bye-bye.